Hi, and welcome to my first vlog in my journey of recovery from minimally invasive fusion surgery at L5S1. Today is Saturday, the 27th of May 2023, and it's basically 3 days before my surgery. So I've struggled to find many vlogs online in my own research, so I wanted to provide an honest and objective view of recovery from my fusion surgery. Including sharing certain things from my own research, perhaps around diet, exercise, medication, supplements, how to manage the mental aspects that may be of use to you. What I will do is try and keep the updates fairly brief. If you're anything like me, then any video of 5 minutes is really going to challenge your attention span. So today is really just an introduction and just to set the context for the recovery. So let's start with the injuries. So I've been living with a degenerative disc at L5S1 for more than 10 years. I think what started it was somewhere between snowboarding, falling fairly hard on my back and my buttocks in my 20s, and potentially also playing squash quite a lot in my 20s. So basically what would happen is every 6 to 12 months I'd kind of have a flare-up. I'd have to take it easy for maybe 5 to 10 days, go to the doctor, get some injections like muscle relaxants and anti-inflammatories, and normally it would settle down after that time. I actually had an MRI done on it 4 years ago whilst we were living in Spain, and at the time what the MRI did show was that there was some narrowing of the disc at L5S1, and there was a small bulge pressing on the nerve, but the neurosurgeon at the time didn't think it was serious enough to justify operating, and therefore suggested conservative treatment. So what's important to note is it was always there. It was never kind of normal, if I can put it that way. So even on the great days, I would say there was kind of 2 out of 10 discomfort in my lower back. I always had to be very careful about bending and lifting, including even picking up my kids, and then of course you would have the flare-ups, but essentially the decision always was to kind of try and treat it conservatively rather than have surgery. So this last month has been very different though. I think what triggered it was I was lifting some fairly heavy boxes in the garage whilst I was doing some spring cleaning, perhaps 30-40 kg boxes, lifting them over my head, and also doing some overhead shoulder press in the gym, some standing shoulder press. I think that's what triggered it. But essentially, I've now got pain all the way down the back of my leg, all the way into my foot. I've got spasms in my glutes, my hamstring, in my left glute, my hamstring, and my calf. I actually can't feel the outside of my left foot, and that includes the kind of last two toes, and generally just pretty severe pain. Whenever I try and make any movement with my trunk or with my legs, for example, getting up from sitting down or getting up from lying down can be extremely painful. And certainly sitting for a long period of time is not my friend. So I did try the usual treatment, as I mentioned earlier. So going to the doctor, getting the injections, the anti-inflammatory and muscle relaxant injections. I've also been on some pretty strong painkillers, including oxy and some morphine-based painkillers for the last couple of weeks, but nothing seems to help at this stage. So I had an MRI done and then saw an orthopedic surgeon straight afterwards on Wednesday, which basically confirmed what I was expecting, which is that there's a serious issue at the L5S1 level of my spine. You can see from the MRI, the kind of view of the MRI that I'm showing on the screen right now, that there's a pretty severe narrowing of the disc at L5S1. But you also can see a fairly large herniation pushing into the back, pressing on the nerve and extending fairly far into the kind of spinal cavity there as well. The radiology report can confirm the same, obviously in various medical terms that I wouldn't even like to pronounce. And then furthermore in testing and consultation with the doctor, there's already discernible weakness on my left-hand side as compared to my right, number one, and also some reflex action issues in terms of, you know, certain activities on my left-hand side rather than my right. What the MRI did show, which was you know, fairly fortunate, and I'm quite happy about, is that all my other discs in my spine are completely normal and healthy, which again makes me think that it was definitely an injury that, you know, caused the problem at L5S1, maybe not necessarily helped by the fact that you know, the kind of lifestyle I lead in the corporate world, this is fairly sedentary. So what surgery am I having? So let me start by saying that when I started doing the research about surgery, I was you know, fairly adamant that should surgery be required, that I would insist on a total disc replacement rather than a fusion. Simply because from what I've been told or read or saw on YouTube, etc., is that because of the fusion removing some of the mobility at the particular joint that's being operated on, what it does is it puts pressure on the adjacent joints, so above and below, which then can over time lead to requiring additional surgery at those levels as well. So it wasn't something that I was keen on, and I wanted to make sure that I therefore retained as much motion. Now, from what the doctor explained to me, it's not going to be possible to do that in my case for a couple of reasons. The first is that because the narrowing of the disc space is so severe, it's going to be fairly difficult to get in there and kind of establish sufficient height in order to remove the disc completely, and also then to do the implant of the artificial disc. But more importantly, because the disc material is pushed out so far down the nerve and kind of into the spinal cavity, he's going to have to come in from behind in order to remove the disc material. So therefore the only option for me in that case is you know, transforaminal lumbar interbody fusion, which will be done as minimally invasive surgery. It will be done through an incision in my back or through the side, which is obviously different to what would be required if you were doing the disc replacement or an A-LIF rather than the TLIF, which is what I'm having. Which in a way is a relief, because I must say I was a little bit concerned about you know, them coming in from the front and having to move organs and arteries and nerves and so on aside in order to get to the spine. So I guess some of that is saved. And the minimally invasive nature of the surgery does, in theory, then also mean that there's less muscle being disturbed and so on, and should lead to a faster recovery. So in terms of the recovery, what I've been told is I'll be in hospital for one night and then be able to go home the next day. I'll have to recover at home for 2 weeks. After 2 weeks, I'll be able to drive and return to work. Although, you know, given the kind of seriousness of the operation, I think what I'll more than likely probably do is, rather than go into work after 2 weeks, is work from home for the first week after I'm able to do so, and then only return in the 4th week. Then physical therapy and rehab starts after week 4, and according to the doctor, by month 3, I should be able to resume, you know, most kind of normal activity, including playing golf and so on. So a little bit about me, because of course recovery from surgery is going to depend on various factors, including your age, what kind of physical condition you're in, and so on. So I'm a 43-year-old married father of 3. All our kids are under the age of 10. I'm a corporate executive, which means I probably spend 90% of my days sitting in meetings or sitting at my desk doing work. However, prior to this injury, so up until a month ago, I was fairly active. So I was spending maybe 2 or 3 days a week in the gym doing weights, followed by some cardio as well, a couple of times a week. Cardio would have entailed either a stationary bike or running. I really enjoyed my running as well. And then I also played golf once a week. I'm 6'2" tall, or 188 centimeters, and I weigh 90 kilograms, or in pounds that would be 200 pounds if you're not from South Africa. So what am I expecting? So firstly, I'm of course expecting pain from the surgery, but I'm really looking forward to the kind of relief from the nerve pain that I've experiencing for the last month or so, which has been completely unbearable. I also know that you know, even though I'm optimistic about the recovery, I also know that doctors can be a bit over-optimistic about the recovery timelines. You know, what I base this on is I also had an anterior cruciate ligament reconstruction on my left knee about 7 years ago, where I was told it would take 9 months to get back to normal, and it ended up taking more like 2 years. Now, part of that was because I didn't necessarily follow the rehab protocols to the extent that I should have. But you know, the 9 months basically would have been someone maybe in their 20s, an athlete who has time to do the rehab exercises, etc. Whereas if you're a little bit older and maybe not in great condition, it will definitely take a bit longer to heal. I'm expecting it to be a tough journey mentally, just based on what I've experienced before. So, you know, lying, being in pain, not being able to do anything, the recovery taking longer sometimes than maybe what you expect, can be frustrating, and it can also be quite depressing. So you have to manage your mind and your emotions, you know, as much as you manage yourself physically. But ultimately, I am expecting to, at some stage, be able to return to most of the things that I was doing prior to the surgery. Even though, of course, I know that I'll probably forever have to be, you know, careful of my back and you know, just not do anything too drastic in terms of exercise or sports and so on. But yeah, as I say, I'm looking forward to getting back to normal. So that's all for today. As I mentioned, it's 3 days before my surgery, and I'm looking forward to sharing more as I go through the process of the surgery and then start the rehab. Thank you.